So what I'm going to do now is we're going to give you guys 8 rules that I kind of put together for you to be able to create that successful home health agency, that home care company. And I hope that from what I share with you guys, you can actually apply this to your organization. So rule number 1, market directly, right? Don't just sit around and plan, organize, and play, right? There's no such thing as having a perfect marketing plan. There's no such thing as having a perfect agency. So a lot of people want to create perfection. They say, I want to perfect this first before we go out there because I don't want to make any mistakes. Guess what? Go out there and market directly. It's time to sell, time to go out there, and then just adjust yourself as you go and learn from the small mistakes, right? Because if you actually researched good enough, practiced enough, then you can go out there and try. Basketball players don't make every single one of their shots, but they take the shots, okay? Because if they were perfect, they would be able to make every single shot that they make. So get out there now and start marketing. Remember that speed is power, right? Fast, not just big. Become the tortoise and the hare at the same time. Promote everywhere, right? You have to be able to find your power partners. Can you market yourself in social media? Are you marketing yourself to the nursing homes, the physicians, the ASLs, the memory care hospitals, and many more? Creating that large pipeline is what's important for you. And also to be able to measure where you are succeeding. So maybe you can concentrate in that particular area. Sales, not clinical, okay? You have to understand, obviously you have to take care of your patients. Obviously those things are in place and should be in place. But you can't provide care for someone that you don't even have to care for. Sales is where money is. Closing is 100% of your profit. And if you're not good at closing, then you're not going to have any profit. If you're not good at closing the deal and getting these referrals, you don't have a company to work for. You can't show how good your staff is unless you can bring clients. So no matter how much you tell a person that you have quality care, provide quality services, have quality nurses, doesn't matter if you don't have patients to show that off to. Do not delegate unless you know how to do it yourself. So this especially is for you owners out there and administrators. You know, you guys want to delegate sales to people, but you don't know how to do sales. So how do you know the person that is marketing for your company is marketing correctly if you don't have any idea what sales and marketing is about? How can you expect somebody to become the administrative assistant if you can't fully explain to them how to become an administrator? You guys have to understand this, that if you open up a business, if you open up a company, if you're going to do that, you should have some sense of that. And if you're willing to open one up and you don't want to be an active owner, meaning working in the company, then you should bring in the right people. Now, when I talk about bringing in the right people, I'm not saying bringing a nurse in just because they have a nursing license and then give them the DON status. Because a DON is more than nursing. It's about managing employees. It's about making sure that, everything is being handled from the money aspect of things, from payroll, all the way to scheduling. There's so much more about that. And there's a lot of nurses out there, but they shouldn't be managers. There's a lot of business owners out there that should not actually be a business owner at all. There's a lot of entrepreneurs who are actually wantrepreneurs. So most of the time is you should have some kind of idea of things. You should look into it before you bring somebody in, because you need to be able to ask them the right questions. You need to be able to see, are they able to do what you're telling them to do? Are they going to do what you're going to pay them to do? And even more. I'm not afraid to get my hands dirty. I used to remember helping out in the office before, and I didn't mind cleaning the bathroom. I did not mind wiping the floors, wiping the tables. I didn't mind, unclogging the toilet in the office in the beginning of things. You have to understand that you need to get your hands dirty sometimes. How can you delegate it if you can't quantify or manage it? I want you guys to think about that. So you should know something about it. Doesn't have to be a professional at it. The best bosses and owners of companies out there are great delegators. Meaning, find out what you're good at. and concentrate on that. And the ones that you can't do good enough, delegate to somebody who can do it better than you. But you should always know a little bit about something before you hire someone. 5, branding first before you go out, right? So part of your whole sales process to create branding, create identity, create loyalty, create value, perception, awareness, marketing. All this is part of branding, right? Think about Apple computers. You already know the logo. Think about Coca-Cola. You know the logo. Think about Pepsi. Well, Pepsi sometimes keeps on changing their brands or the way it looks, so kind of changes a little bit, right? Think about, but I'm sure you still remember Pepsi logos from the 90s. Think about, for example, Toyota, Honda, Nissan, right? Brand awareness is important. So what you need to do is you need to do some branding for your company, your website, your logos needs to be on point. You have to make sure that you have a clear understanding of your company and what products you guys actually provide and offer. You know, what programs you have within your home health agency, your home care company that you have. Know who you are and what you stand for before going out and create clarity in your pitch. The better you know the consumer, the better you can actually let them know about yourself. You want to become the person that gets called when they need a patient to be taken care of. And it's not about trying to be the brand for the whole industry. That is the plan as well, okay? But how can you brand yourself where within each of the place that you market to, that they're going to recognize you as the one that they want to call? If really it is, Amedisys, for example, one of the largest organizations, great company. I've dealt with a lot of the people that works for them, okay? But they don't get all the money. They don't get all the referrals. So even they are still working on their branding. You watching this video, listening to this video, probably never even heard of Amedisys. But trust me, they're in your area. And they're slowly increasing, which they're creating smart moves, smart planning. They're reaching out to other people to join together. If they can't reach out with them and do a joint venture, they're buying those companies. That's what branding is all about. You need to create multiple flows of income. If you only have one flow and that faucet turns off, you've got nothing, right? If you're relying on just one facility to provide you all your referrals, or maybe more than 15-20% of your referrals, something's wrong. You need to be able to increase that, right? So that if there's any loss, you can manage that loss. If you only have one marketer who's marketing your company out there, let's say he's a great marketer and he's bringing in 30-40 patients a month. Imagine if that marketer leaves. What now is going to happen? You have to understand that you have to have multiple flows of income. If you're a home health agency providing medical, you should think about providing home care non-medical. You should think about starting a hospice. You should think about adding pediatric patients. You should think about staffing. You should think about having multiple nursing homes referring to you, multiple physicians, multiple hospitals. You should think about not just accepting Medicare, but how can you accept Medicaid and as well as other insurances? Yes, Medicaid pays less, but guess what? That's where management works in your company. That means you might be paying nurses too much money, and that's why you can't afford taking care of your Medicaid patients. I know several home health agencies that are Medicaid as their number one patient source because they were able to handle the business aspect and create the right financial payments for nurses to work with those type of clients, which in turn, they get more Medicaid patients. But guess what? Because they handle and they don't mind handling Medicaid patients from facilities, they are getting the Medicare patients as well. Because it's a one-stop shop. Expand, don't retract. Grow while others retreat. Growth is where it's all at. Get big or go home right now. Listen, you have to understand, while there's a moment of retraction, do you know how many agencies in Illinois, because of the pre-claim review, stopped admitting patients? Instead of stop admitting patients, why don't you get more patients, because a lot of agencies are not admitting them. And second, figure out the pre-claim review and succeed on it. The government just wants you to do a little bit more work, right? So we have to understand. We always have to expand and not retract. And if you retract, that's fine. If you're going to step back a little bit, but you better make sure you step forward, step sideways. I would rather step sideways than backwards. Right? If I always move forward and I hit a roadblock, I just have to move right to keep moving on, rather than stay behind that roadblock and not move at all. Start firing if you want to grow. There are people in your organization right now that needs to be fired. There are people preventing you. You may even have a great employee who does great at great at coding, great at billing, but that person is causing a toxic environment in the company. That person needs to go. So it's either perform or get out. Do you want to be part of this organization that's going to create success or not? And if you don't want to, step aside. That's what you tell a person. A lot of the times is we don't want to fire people because we don't want to hurt people. Well, guess what? Some people need to be fired. There are a lot of people out there that deserves to be fired. And I'm sure right now as we're talking, if you're an owner of a company, there's about 10, 12 people in your organization, if you have a large organization, that you want to get rid of. And you should just get rid of now. Make the decision now. Okay, so I hope you guys actually enjoyed this particular video, this particular training that we provide you guys on how to be able to create a multi-million-dollar home health business. Always understand that our goal here at Home Health Success Academy is to give you guys so much information that it's so valuable for you because we want to be able to work with you. This particular video makes perfect sense especially for owners out there who wants to create that successful agency. What we're doing here is we're trying to teach you guys things and solutions that help us with the mistakes we faced in my industry, in my companies, in companies that I've helped and worked with, and marketers that I've spoken to. What I'm doing here is providing you the knowledge of the mistakes that have been made. At the same time, knowledge of what creates a multi-million-dollar agency.